Often, the most compelling justification for permitting cigarette sales in the U.S. is profit. However, when a U.S. industry inflicts billions of dollars in U.S. healthcare costs annually, in addition to causing 20% of all U.S. deaths, this logic is questionable at best. In March of 2021, the CDC's Office on Smoking and Health released a study on U.S. healthcare spending attributable to cigarette smoking in 2014, which exposes the substantial economic burden of cigarettes in the U.S. Their research found that adults' cigarette smoking accounts for 11.7% of all U.S. annual personal healthcare expenditures. This amounts to $226.7 billion in 2014, and unfortunately, it's up to the federal government to foot the majority of this bill. More than 50% of smoking-attributable healthcare spending is funded by Medicare or Medicaid. When other federal programs are included in this total, the price that the federal government pays increases to 64.5% of all healthcare spending attributable to adult cigarette smoking. This means that in 2014, the U.S. federal government spent an extra $146.2 billion on healthcare just because of cigarettes. Therefore, it's imperative that decision makers employ proven, population-based interventions, such as increasing tobacco taxes, implementing comprehensive smoke-free laws, such as those in Brookline, Massachusetts, and Beverly Hills and Manhattan Beach, California, and improving cessation access, among other effective tobacco control policies. These interventions reduce the demand for health care to combat smoking-related disease and death, effectively lessening the $226.7 billion in annual U.S. smoking attributable healthcare costs.